Maintaining the head in midline for brief periods is rather typical posture for 2-month-olds, who are just beginning to show anti-gravity activation of the anterior neck and chest muscles. Although at this age, babies don't stay in a symmetrical position for a long time, Marty is able to locate the object and to track from left to right. He is also showing some anti-gravity movements, lifting his lower extremities off the support surface and beginning to demonstrate reciprocal kicking. He is not able yet to reach for toys, even with the tactile cueing of brushing the object against his hand. We should see this evolve in the next 4 to 6 weeks. The tummy muscles are engaged, but not strong enough yet to lift both legs toward the tummy, which is something we should look for by 3 months. In Owen, we see lower muscle tone and more asymmetrical movement. In his head movements, we see more of a predominance of the head turning to the right and less spontaneous head turning and crossing of midline. He is able to latch on to the visual stimuli, the toy, but he can only track as far as the midline and does not turn his head to the other side. We also see much less lower extremity anti-gravity movement. He does not have the endurance and muscle activation to sustain his posture against gravity. His movements are slower, and there is not as much variety in how he's moving his arms and legs. We see much less reciprocal kicking and no lifting of the forearms from the table surface. His movements are much more repetitive, and he has longer periods of inactivity during which he maintains his arms and legs on the support surface. While Marty can't independently roll to the side, he is able to lift his head and upper trunk during a facilitated roll. Initially, he resists the rolling movement, but once he gets into the side-lying position, he shows lateral head righting and the ability to follow through into rolling with head lifted into prone. We also see how Marty demonstrates an integration of the major muscle groups. He can switch from using abdominals during the roll and then recruits neck and back extensors as he completes the roll. Of all the 8 positions we will see, Owen looks most competent in side lying, which is why we recommend looking at the baby in more than one position. This position doesn't require him to work as hard against gravity, so he is comfortable here and looks much more symmetrical. His atypical movement is not as obvious in this position, which lets us know that he has possibilities to produce more organized patterns of movement. He can remain in side-lying position without rolling onto his back, but he does this by strongly flexing his hips and knees, increasing his base of support to counter falling backward. Looking at a baby in all 8 positions will help professionals best determine which course of action, if any, is needed. Here we see some nice head lifting and extension through the thoracic spine. Marty's hips and knees are moving out of the flexed position into an extended, abducted position, shifting his weight posteriorly toward the pelvis area. This frees his upper body so he can lift his head and upper trunk off the support surface. We can also see little weight shifts from right to left, which he's able to counteract with his abdominals to balance himself, all the while increasing his shoulder girdle strength and changing the sensory input on his arms. As his legs progress out of the flexed newborn position, he is able to lift his trunk and begin using his vision to fix on something in the distance. At this age, you should not expect the elbows to be in line with the shoulders, and he will not yet be reaching for toys. We see that Owen has a much more newborn-looking posture, which shifts the weight forward towards the head and shoulder area, making it more difficult for him to lift his head up. He has much more hip and knee flexion than Marty. Once the hips are extended, he will be able to start to lift his head up a little more. It's important to note how changes in the leg position allow the infant to begin developing head and trunk control in the prone position. If Owen does not independently progress to the more extended and abducted legs, he'll be stuck in this position, unable to lift up his head and push up on his arms. His strategy to get any movement is to extend and push up on his legs, which is a non-productive strategy because it doesn't assist him in lifting his head and pushing up on his arms against gravity. When the examiner uses a rattle, Owen gets quiet and listens. But because lifting and turning his head is so difficult when his hips are flexed under him, he is unable to find the auditory stimuli, even though he hears it. When the examiner pulls Marty into a sitting position, Marty demonstrates head lag that one would expect in a typically developing 2-month-old. We see he is able to engage his neck muscles and bring his head into an upright position without it falling forward, and he sustains head control in midline for 10 to 15 seconds. Typical of a 2-month-old, he's not able to assist in the pull to sit, but he is able to generate muscle activity in the shoulder and upper arms to stabilize the upper body. In sitting, he has extension from his cervical spine through the upper thoracic spine. In Owen, we see scapular abduction rather than scapular adduction. We also see little muscle activity in the upper extremities to assist with shoulder stabilization, which results in Owen's head falling forward onto his chest in the upright position. We see very little activity in the cervical spine. Owen's inability to lift his head and push up on his forearms in the prone position is directly related to his inability to use his shoulder girdle to stabilize his upper trunk during pull to sit. We also see rounding through the cervical spine right down into the lumbar spine. We should be seeing the ability to hold his head upright and stabilize with the scapula, and he should have spinal extension through the cervical and upper thoracic areas. Here we see good alignment of the head with the ear directly over the shoulder. There is good activity of the neck extensors. Marty is able to hold and sustain this posture. We don't see a lot of head turning, but this is typical of this age. Marty hasn't yet learned to separate head and trunk extension, but within the next month, this will develop and he will be able to track objects in sitting. We see in supported sitting that the examiner must use more control on the front and back of the trunk to allow Owen to sustain this sitting posture. He has one burst of muscle activity trying to lift his head, but he overshoots the upright position and his head falls forward. This handling position of the examiner is also for safety. The hand on the back is to protect his neck in case he overshoots the upright position. In general, we see he doesn't use his arms. They are very inactive because he lacks shoulder girdle strength to initiate arm movement against gravity. In this position, we are looking to see whether the muscles of the neck and trunk can sustain this posture against gravity, and in Marty's case, they can. When he experiments with moving the entire arm away from his body, we can see that the head control is compromised and falls slightly into flexion. Typical of a 2-month-old, this indicates he doesn't have enough trunk extension to hold the body against gravity without recruiting the muscles in the shoulder girdle to augment the thoracic extension. Unlike Marty, we can see that in this position, Owen is unable to lift his head or activate his neck and his upper thoracic extensors. Instead, he tries to use the same strategy he did before, which is to move his arms and legs to initiate movement. This is a non-productive strategy. Owen needs to develop his trunk strength. Poor head, neck, and core strength is interfering with competence in several postures. When we tilt the baby forward, he not only sustains but increases the head and neck extension. He brings one arm forward, but the left arm is flexed and adducted, close to the body. This posture helps him increase the spinal extension during the forward tip. Marty is on track in demonstrating fundamental control in this position, so that by 6 months he'll be able to extend the head and neck during the forward tip and quickly and easily bring the arms forward to protect himself from contact with the mat. As we tip Owen forward, his inability to lift his head and extend his trunk when being held in horizontal suspension carries over to the forward tipping maneuver. He's unable to generate any head or trunk activity. Without early intervention to develop more trunk strength and optimal movement patterns, it will be highly unlikely that Owen will develop the head and trunk control to allow the mature protective response by 6 months. When placed in supported standing, we see that Marty is able to sustain weight on his lower extremities while the examiner supports him at the trunk. The intermittent bouts of extension and flexion are typical for 2 months. His head is in line with upper trunk, but he is using shoulder elevation and upper extremities held close to the body to assist him in sustaining his head and trunk posture against gravity. There's a good vertical alignment from head through trunk down to the feet. When Owen is placed in standing, he is only able to sustain pseudo-extension when the examiner is providing maximum support and lifting. He has no intermittent muscle activity to attain or maintain the standing posture. Every time the examiner tries to let him take weight on his feet, he collapses into flexion.